From the most trusted names in local news, KDPG Sunday Edition.
Good morning, everyone. Welcome to the KDPG Sunday Edition. I'm Ken Rice. In the long drama of trying to provide health care to all Americans, a new page was written last Thursday, and it was a big victory for President Trump, coming on the heels of his 100th day in office. House Republicans, with no Democratic support and just one Republican vote to spare, passed their own version of health care, the American Health Care Act, to replace Obamacare. Even though 20 Republicans voted no, there was a big Republican celebration in the White House Rose Garden. CBS News Capitol Hill correspondent Nancy Cordes has more on what's in this new bill.
This has really brought the Republican Party together.
President Trump savored the legislative victory in the Rose Garden after House Republicans passed their bill with one vote to spare.
The ayes are 217, the nays are 213.
GOP leaders decided to hold the vote after a last-minute boost in funds for people with pre-existing conditions appeared to sway some holdouts.
I'm trying to get back and read it now.
Even as protesters heckled them outside. Shame! 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 And Democrats inside warned Republicans would pay a political price.
But you have every provision of this bill tattooed on your forehead. You will glow in the dark on this one.
The bill eliminates or alters the key elements of Obamacare, which House Speaker Paul Ryan described today as a failed experiment.
What protection is Obamacare if there is no health care plan to purchase in your state?
His plan provides tax credits to help individuals buy insurance, though many low-income and older Americans would get less than Obamacare currently provides. Insurers would be allowed to charge older customers 5 times more than younger ones. Obamacare capped that ratio at 3-to-1. States would also be allowed to roll back the requirement that all insurance plans cover a set of basics, including maternity care and emergency services. Indiana Republican Larry Bouchon.
This is going to bring down premiums and get things back on track and give people options.
Republicans did not wait for the Congressional Budget Office to determine the cost and impact of their bill. An initial analysis projected it would leave 24 million more Americans without coverage, 14 million of them due to Medicaid cuts.
Tens of thousands of Americans will die if this bill passes. That's a fact.
The numbers worried some GOP moderates.
You're a no on the bill?
I am.
But many Republicans, like Alabama's Bradley Byrne, insist the bill will get better now that it has left the House.
So it's going to go to the Senate, be changed, come back here, but it's a big step.
Do you want it to be changed?
I think it could be improved, I do.
Senate Republicans have already established a 12-member working group to modify the legislation, though they haven't given a timeline. There was a lot of urgency in the House to get this done, but senators say they're more focused on getting it right than moving quickly. Nancy Cordes, CBS News, Capitol Hill.
This morning on the KDPG Sunday Edition, what the American Health Care Act means, what the future might be for this bill as it moves on to the Senate. In a few minutes, we'll meet Sister Rosemary Donnelly, professor and holder of the Jacques Laval Chair at Duquesne University School of Nursing. But right now, we welcome two guests, Dr. Karen Wolk-Feinstein, president and CEO of the Jewish Healthcare Foundation and its 2 operating arms, the Pittsburgh Regional Health Initiative and Healthcare Futures. Also with us, Dr. Martin Gaynor, E.J. Barone, professor of economics and health policy at Carnegie Mellon University's Heinz College of Information Systems and Public Policy. David Schrimman is away this week. John Allison, editorial page editor of the Post-Gazette, joins us. John, always a pleasure to have you along. Welcome to both of you. Let me start with you, Dr. Feinstein. What, in your opinion, what is the most significant thing in this new version of health care?
Oh, there are quite a few things. And if you don't mind, just quickly, the cutbacks to Medicaid, that's going to have a huge impact. The effect of this on hospitals, particularly our community hospitals in low-income areas, rural areas, downright scary. Even the effects on the basic medical office, medical practice. So it's not just about the people insured. And the one thing that I guess everybody has to feel some concern about is we're not going to have maternity and ER benefits that are sufficient. What do we need health care insurance for?
All right, let's pause there. What you're talking about is the requirement under Obamacare that there are essential health benefits that policies offered by insurers must cover.
Yes.
Which include things like maternity care, mental health care, prescription drug coverage. This bill does away with those. So insurers can offer slimmer plans, right, that for some would be more affordable. Right, Dr. Gaynor?
Well, states have the option to opt out of that standard situation, and if they do that, then they can redefine what essential health benefits are. And you're right, that could really change things. So if a state chooses a different set of essential health benefits, people not only may not get offered policies that cover those benefits, they may lose some of the protections of the Affordable Care Act on how much they have to pay out of their own pockets. The Affordable Care Act said, look, no insurance policy can impose a limit on coverage for care, either on an annual or a lifetime basis. That's really important because what do you need insurance for? You need insurance against these catastrophic costs. And so lifetime or annual limits are terrible, but they only apply to essential health benefits. So if those are reduced, then people could be on the hook for just a terrible amount of expense on some of these very important kinds of health care.
And caps on yearly and lifetime, would that also affect people with private employer provided insurance?
Potentially that could also affect the employer-sponsored part of the health insurance sector, which is where the majority of us get health insurance. And so there are profound ramifications potentially from this aspect of the bill.
Let me ask you the same question, though. To you, of all of these changes, to you, what sticks out? What is the biggest, the most significant change?
Well, I'll cite two numbers, 24 million and 52 million. 24 million are estimated to lose health insurance coverage by 2026 under the AHCA, the American Health Care Act, leaving 52 million of us without health insurance at that point. That's almost 1 in 6 of every American.
You're referring to the Congressional Budget Office estimate for the original American Health Care Act. This is an amended version, however. We don't know what the CBO score is yet because it hasn't come in yet.
Correct, and we don't know because the House Republicans didn't give their own Congressional Budget Office the time to do these estimates, and they just went ahead and passed the bill without actually knowing what the impacts would be. However, I think there are good reasons to think those estimates would apply to this version of the bill.
John, I'll let you jump in.
Well, fortunately, my current insurance covers my mental health, so this thing is driving me crazy, so I got to talk to somebody about it. But to preserve my mental health, can we just ignore what has been passed? It's going to the Senate. It's going to be changed completely. Whole thing may crash and burn under its own craziness. There's so many people against it. Karen, please tell me. Can I calm down a little bit?
Well, the thing that concerns me along the lines of your inquiry, how many people are really informed? There's a good reason to excuse yourself and say, why should I be informed? You know, whatever happens here, it's going to get changed, it won't get passed, something will protect me. But I worry that that is now become the common approach to health care reform. It is complicated. I know that the president was celebrating that they did this in a nanosecond, you know, like, wow, we did this in record time. There's a reason it took the Clinton plan 2 years to get born. There's a reason it took the ACA all that time. These are really complicated.
I had no idea it would be this complicated.
These are really complicated things with great ramifications. And I do think everybody in Pennsylvania, particularly Western Pennsylvania, is well aware that health is the largest sector of our economy, next to people employed in government, some of whom are healthcare employed. But, you know, we're playing around with something that could destabilize our whole economy, and I really think I'm not exaggerating. And how many people are informed? You know, I guess we all read the news yesterday, but many of the Republicans who voted for this acknowledge they're not really sure what's in the act. That wasn't reassuring.
To what extent is the president and Paul Ryan and other Republicans correct when they say that Obamacare is a disaster and that insurers are pulling out of the state markets, deductibles are rising, premiums have been going up. It's not working for insurance companies, and therefore it's not working for Americans. They're right, aren't they?
No, I don't I don't think so. So some facts are correct. Premiums have risen for some people in some places, and insurers have exited. But we also have to remember many insurers are actually doing well. Many insurers are making a lot of money. Another thing to be aware is the following. This is a new market. In any new market, in any sector of the economy, you get a lot of churn. On average, in a 5-year period, half of all new firms in a market exit. So this is not unusual. Nonetheless, there are things that do need to be done to stabilize and help the ACA. And one of my concerns, and I'm echoing something Karen said, is that this represents a missed opportunity to address some important issues that will help the ACA and help all Americans by making health insurance markets function better.
Give me one or two things you would include if each of you were part of the negotiations as it moves to the Senate.
Well, and a really interesting issue, by the way, this could have been nonpartisan. I mean, there's a different way of approaching this. I was very active in trying to get the ACA passed. I see problems. Those who are in favor of a Health Care Reform Act didn't get the act that they wanted either. And a lot of this is bipartisan, but that's not addressed. But also, let's put this on the table. They did not repeal the ACA. So let's not pretend that this is a celebration. There are many good things that are still there. First of all, the Medicare, changing Medicare in favor of alternate payment methods, that's there. The money for experimentation on quality and safety, workforce issues, a lot of these things are still there, and they're very good. The big issue, the biggest issue, the gorilla in the room is we've got to bring down the unit cost of care. Other nations who do universal coverage, everybody is covered, they don't have anything like our unit cost of care. So we can keep dabbling and play at the margin and do the kind of things we're doing with the new AHCA. The issue is we're not getting down to the core of why we can't afford to insure everyone, and that's the unit cost of care.
Is it true that we pay a far higher percentage of our GDP toward health care than any other?
Oh, sure.
Any other
$1 out of every 6 in the United States goes to health care. It's the biggest sector of the entire economy. And I agree with Karen. I think cost of care is the single biggest thing in making insurance affordable. If you look at the premium dollar for health insurance, 80 to 90% of that dollar is health care costs. So actually, this is a little off topic, but some colleagues and I have developed a set of proposals
quickly, please,
to make health care markets work better to drive that down. But I would say there are 2 other things I would do to the Affordable Care Act in addition that could help. One, we have to find ways to encourage and support young and healthy people in enrolling. The mandate just didn't do a good enough job of that. So there are some things that could be done in that direction. The other is we do have to help out health insurers. Some health insurers are having a tough time, and we don't want to reward bad management. But some health insurers got caught with sicker than expected populations, and there are some things that either were part of the Affordable Care Act and didn't make it all the way through, or that could be done to improve it, that will help health insurers so they can be stable and have the marketplaces be stable.
All right, we got to take a break on that note. When the KDPG Sunday edition continues, we'll be joined by Sister Rosemary Donnelly, a woman with a lot of healthcare experience as a professor of nursing, nurse practitioner, sister of charity, even a veteran of Capitol Hill. We'll be right back. Welcome back to the KDPG Sunday edition. We're talking about the Republican health care bill just passed this past week. Back with us is Dr. Karen Feinstein of the Jewish Healthcare Foundation. And joining us now is Sister Rosemary Donnelly, professor and holder of the Jacques Laval Chair at Duquesne University's School of Nursing. Sister Donnelly is also a member of the Sisters of Charity of Seton Hill. Thank you very much for joining us. Nice to have you here. Well, in your opinion, let me ask what I asked our other guests. To you, when you look at what was just passed in this health care bill, what stands out the most? What's the most significant change?
I think the fact that it's just one bill that passed one House.
Right.
We're bicameral. There's the Senate, and then there's the conference committee. And I didn't like the fact it was done so quickly. I worked on the Hill at a Robert Wood Johnson Health Policy Fellowship the year that President Carter tried to put forth a health care plan, and health care is much more complicated than it was then. And so I think you have to look at what are going to be the consequences, the sequelae of it. What's going to happen to the people who in our country are most disenfranchised anyhow? And if you just look at southwestern Pennsylvania, we're getting older, and we have probably the second largest aging population in the United States. And this isn't, you know, Dade County, Florida. It's not warm here. We live up 3 flights of stairs. And there are a lot of things that affect health. Certainly one is health insurance, but social determinants of health, where you live, your zip code, do you have food? Do you have some security? Does somebody care about you? And then what happens when you get sick? And what happens with, as I understand it, with the bill that was passed yesterday, you just have to be hopeful and maybe trust in God, because the insurance card, if you have one, would not mean, if this becomes the standard, if this becomes public law, whatever number, it's not comforting if you're older, if you have chronic illness, especially one that makes it expensive to care for you, if you have a complicated pregnancy, if you would like to prevent some things by some screening. It might help you if you're a young person, but eventually you'll get older too.
Has Obamacare addressed those concerns, or did you find that lacking?
Well, it was nothing. Dear God, nothing's perfect. It wasn't perfect, and it became more expensive than they envisioned and planned. Even the CBO. A lot of insurance companies came in and went out of the market. This scared people. They had fewer choices. There also, but a lot of other things were happening in the healthcare system in the last 10 years, and that affected it too. I think access to care is certainly having either money or insurance, but it's also hours and a whole lot of other things.
Right.
Big picture, what's the chance that out of all this chaos, in a certain number of years, we just throw up our hands and say Medicare for all? That we're trying, bang, it just crashes and burns, and this is a path to its creative destruction, and we're going to emerge out of this.
Well, I think Califano said that years ago. That
Joseph Califano, Secretary of Health.
Yes, and Bill Clinton said it too.
Okay.
That it will teach us that we need universal health insurance. Now, when?
Right.
I don't know that.
Yeah.
Because I have trouble explaining this to some European people I know, who I happen to be married to, and just one. And
thank you.
Right.
That makes me feel better.
And I say America is different. America is the land of the individual. We're not a paternalistic society, giving, you know, caring for you. But well, can we change our mentality to say?
Yes, what if we had done something really sensible, and I think doable, and that is, since the Affordable Care Act has not been repealed, the Republicans would have said there are many good things. The president did the best he could. You're trying, you had great intentions to insure many more people, but it's not a perfect act. There's a lot of imperfection. Let's get together, bipartisan, and look at countries with universal coverage. And what do they do that we don't do, and what could we do together to move us closer to universal coverage without in any way sinking our whole economy with our healthcare costs? And I think that's doable.
But can we think about it as Social Security? Can we think about it, you know, Ken, you mentioned that it's, you know, right now it seems so foreign. Healthcare, I'm not paying for your healthcare. It's your, you know, I get it from my employer. But if we say, hey, just build into the system like getting a driver's license,
right? There's
your Social Security.
A small flaw with Social Security. You could predict the number of people that would be eligible for Social Security. Maybe not who would take it at 62 and who would take it at 65. But you really can't predict the number of people that are going to get sick. You can't predict traffic accidents.
Right.
Dear God, who would have predicted the opium epidemic? And now I'm not saying there aren't smart people with numbers, but that's a little tricky. But Social Security worked, and it works.
But if you look at what other countries do, they're much healthier than we are. Every affluent country, you understand, is healthier than we are, and the per capita cost is half. So they spend half what we do, and they have healthier populations. So I'm laughing. This actually removes money for state prevention and public health efforts, and I'm thinking, you've got to be kidding me. But other countries invest much more in primary care. They reduce waste, and that is really a very, very serious issue. They have cheaper pharmaceuticals, and you can go down a list of things. They're not all that complicated. They've reduced the cost of care by half. They've invested it wisely in primary care and prevention, and they've encouraged healthy behaviors everywhere they can think of. So by the time you put that together, it's not that complicated. It's totally bipartisan, and we could do it. But instead, we're wrangling over things that, you know, are almost hard to imagine are better for this country, for the health of the population, and are going to save enough money to be impressive.
What about the idea that for Republicans, it's about more than health care, it's about more than insurance, it's about freedom. Don't force a mandate on me. Don't force me to buy insurance if I don't want it. If I'm young and healthy and I don't feel like I'm going to get sick and I don't feel like I need insurance, don't force me to do that, to subsidize insurance for older, sicker people. So on the one hand, the Republicans are saying, you know, let's return some free market principles to the system. Whereas for Democrats, they might argue it's a matter of social responsibility, a matter of morality. Do you see it breaking down in those terms?
Well, I do, but you have to remember my background. I think...
Well, that's why you're here. We wanted your perspective.
I think that, you know, when you look at it, you say, okay, I'll take care of myself, I'll take care of my family, and maybe I'll take care of somebody if I have extra money. Now, okay, you could call that selfish. You could call it prudent. You could call it a lot of words. But do you want to do that with something that's a public good? Do you want to say, well, I'll educate my children, and you all can take care of the rest of your children? I mean, that's exactly not how America is.
But you could also frame this in a way that is bipartisan, and that is the Republicans could just acknowledge the individual mandate came out of a conservative think tank. It was endorsed by Republicans. And I'm saying we don't have to make this political. They could say, we acknowledge the individual mandate came from us. The really important thing is, why don't they get together and say, what is good for our population health? What is good for our economy? What is good for the nation? You can't be, I'm in healthcare, right? But I'm going to be the first one to tell you, we can't shortchange transportation, education, workforce development, and all these other things. Why can't we get together? Because I will tell you, I hear you're split, but in a way you could pull it apart. The Republicans care about the economy. They came up with the individual mandate, and I think we could all get together and say there are many ways that we could make this affordable, we could make our population healthier, but also we have got to reduce what we spend on health care. There are other things our nation needs to invest in, and we all agree with that, Democrat and Republican.
Point taken. We only have about 30 seconds left, and I'm going to ask you a big question with not a lot of time. Representative Mo Brooks, Republican of Alabama, said that people who do the right thing, he said people who try to keep healthy, who eat right, these are the people who are essentially being penalized for people who don't. In other words, saying that, you know,
that's
why
too
should...
simple. That's much too simple. If you live in a poor community, there's not access sometimes to grocery stores like in Clairton, or in the Hill District, thank God there finally is one now. But choices of food, information about food, even time to shop. Like if you're working 2 or 3 jobs just to get by, you're not a gourmet cook on television.
Right, right. There are many factors. I agree with you on that. All right, we are unfortunately out of time.